Well, Ghana now has more than 2,000 confirmed cases of COVID-19. Per World Health Organization standards, we've reached the pandemic stage. What more should government focus on at this point? Well, should we be tackling it any differently from what we've been doing? We want to engage some persons with knowledge on the subjects of viruses and have a conversation on the back of that. We also want to talk a bit about mental health and how we can rope in that in as we go forward with this fight against coronavirus. You can see our case count and how the situation looks like on your screen. What should we be doing again? Is what we're doing enough. We've got Dr. Ruth Owusu-Antwi, who's head psychiatry unit at the Comfort Teaching Hospital, who'll be joining us via Zoom in the course of the conversation. But to begin it with, we've got Dr. Samuel Essien-Baidoo. He's a virologist at the University of Cape Coast. Oh, there you are, Dr. Owusu-Antwi. Good to see you. Good morning to you.
Good morning, Bernice. Good to see you too.
Okay, this is Mama V. This is Mama V and Dr. Samuel. Yes, ma'am. Dr. Essien-Baidoo.
To be here.
Yes, you did. You spoke to Bernice. Dr. Essien-Baidoo, good morning to you as well.
Yeah, good morning, Mama V.
Great.
And, good morning to your viewers as well.
Great. Good to have you both. You know, just to begin the conversation, on the surface of it, and as ordinary Ghanaians would ask, this is to you, Dr. Essien-Baidoo. The numbers are going up. Why is that? If we have a grip of, and if we know how the virus operates, why are we still climbing?
Thank you very much, Mama V. Our numbers are going up because if you look at our case counts, we've also done a lot of testing compared to other African countries in particular. And it is also obvious from the routine surveillance, the mandatory quarantine, and the contacts that have been traced to have that percentage of infection within our community. So it's largely due to our enhanced capacity to test. That's why we have this number.
So I've got a quick, curious question there. Why is it still going up? Because then shouldn't we have a way of stopping it? I mean, the fact that you're testing, should the results be positive?
I think looking at it largely, if you look at our infection rate per million within our population, I think it is still very minimal. It is not even up to 1 as we speak. And this is very good for us. I mean, if you look at the strategies that have been put in place, and if you look at research reports from Wuhan, Italy, and the US where it started, the very first 3 months is crucial to the spread of infection. Once we're able to contain the infection within the very first 3 months, below an index of 1, then we are good to go.
Dr. Essien-Baidoo, you seem to be breaking up a bit there. I'm not sure if you can hear me, Dr. Essien-Baidoo. We're going to work on that connection. But let me engage. Okay, you can hear me. All right. Can you just end that statement because we missed the greater part of it?
Yes, so basically all I'm trying to say is that apart from our enhanced capacity to test, it is also very important to note that from what is happening elsewhere, the very first 3 months is crucial in the dynamics of the spread of the virus. And if you look at our total number of cases vis-a-vis the total number of tests that we have done, basically the effective reproduction number is still slightly above 1. But if you look at the proportion per million of our population, it is still below 1, which means that, yes, we have tested enough, we've reported enough cases, but there's no cause for alarm. We are still within a comfortable place where we can confidently say that we are containing the spread of the virus. We're not seeing that exponential increase in the number of people who become infected over the period.
What's your understanding in terms of the backlog that we have of samples yet to be tested?
I think we've done a very good job with our routine surveillance and contact tracing. Basically, what that would give us is a slight surge in the which is also expected. Hello.
Okay, Dr. Essien-Baidoo, now I think we need to take a breather from you. Let me go to Dr. Wusu there. Whilst we still work on your connection, we seem to be having some breaks, and it doesn't help with the flow for this conversation. So we're going to work on that. But let's turn our attention to the head of psychiatry units at the Komfo Anokye Teaching Hospital. Perhaps what we don't remind ourselves of a lot of times is that all these numbers, when we talk about over 2,000 infected, when we talk about these numbers, they represent human beings. When we talk about a number of samples that we've taken, waiting to be tested, and the people waiting to know the results of those tests, there are human beings behind that as well. So I want us to get into the mental conversation with you. There are people waiting for their results. And on Newsfile on Saturday, we had somebody call in to say he had been tested with his wife and they've been waiting for the results. So for people who have taken their samples who are waiting for the results, how do you calm yourself? I mean, there are doctors I've spoken to who have said when they took the test, waiting for the results, it's almost felt sometimes you feel there's something in your throat, you're almost feeling like you have it. What's going on, like, if you're waiting for your results?
Yeah, thank you very much, Mama V. It is not mentally easy. In fact, this pandemic is affecting our physical life as much as our mental health. It goes right from the time you go through the screen and you are told for the first time that you are a suspected case or you are likely to have COVID-19. And so we have to go and screen you. And so even before you get your samples taken, there are a whole lot of mental and psychological, including emotional symptoms that take place or that rise up in individuals. Is it it? Is it going to be it? Is it going to be positive, etc.? And then when your sample is taken, whilst you wait for your results, it is not easy. People become very anxious. There is a woman I spoke to that said that I'd rather die than to wait for these results because I've heard how it is killing people, etc. And so people become really, really anxious in the waiting period. And that is why the mental health aspect of this pandemic should not be neglected. Otherwise, as has already been said, what will kill people will not even be this disease, but other conditions or other complications rather.
Do you think we've effectively incorporated that in our fight against COVID-19?
Please again.
I'm asking if you think we've effectively incorporated the mental health aspect of this against the fight against COVID-19.
I don't think we have done enough at all. I don't think we've done enough at all. What I am getting is that we only rope in mental health aspects when the individual actually starts showing signs of mental distress, etc. But it should be part of the whole process, right from the beginning, when a patient is said that looking at your symptoms, we suspect that you may have COVID-19. isolate yourself and let us screen you. And that psychosocial support should not be given to only the patients, but to the healthcare provider as well. If you are sitting at the triage and you see these patients who similarly have symptoms that are very suspicious, there is that instant fear or anxiety that grip you. And so the support should be given both to the healthcare providers and to the patients right from the beginning, throughout the time they are diagnosed, they are in the isolation centers. In fact, WHO recommends that 1 month post-recovery, people should still receive psychosocial support. And I don't see that being actively done in the country.
I see Dr. Samuel Essien-Baidoo. I can hear you. Hopefully we have we don't have the breaks that we're experiencing. He's a virologist with the University of Cape Coast. Now we're trying to understand how else we can fight this virus here in our country. And I've been asking you, Dr. Essien-Baidoo, very ordinary questions that I hear people also ask. If we'd say, and let me just quote something, when the president was lifting the lockdown, he said, and I quote, "We have a better understanding of the dynamism of the virus." And one would interpret that ordinarily to mean that we shouldn't be going up with the figures. And that's why I asked the earlier questions that I asked you. So how do you explain to the ordinary person that we understand the dynamism of the virus and yet the case counts still going up, and then we see other regions also recording high numbers? So let me just straight away on the back of that ask, are we approaching this right?
Yes, we are approaching this right. I think that as a country, we've developed the right models to understand the dynamism of the virus, as the president indicated. Our numbers do not necessarily seem to be rising because we have a backlog of tests that we're still doing, which basically would give us some high numbers within the periods that these samples have been taken. What is interesting is the fact that, and I repeat that again, that if you look at our infection rates per million of our population, it is still below 1, which is a very good sign for us. So I think we're doing something good with regards to minimizing the spread of the virus.
Let me come to you, Dr. Usu Entry, and she's head of psychiatry unit at the Komfanoche Teaching Hospital. How do I know if I'm really exhibiting symptoms of this virus, or is just my mind playing tricks on me, especially if I've taken the tests and I'm awaiting the results?
There are several symptoms that would show up physically. There could be palpitations, at the news of sample has been taken or a diagnosis has been made. People can suddenly have headaches. They can feel detached or numb suddenly. There could be breathlessness. Cognitively, people feel that they are overwhelmed. They get confused. They start to blame themselves. Was it my fault? I shouldn't have gone that place. I shouldn't have done this or that. Then fear grip you. People become anxious. Some people become angry at the whole system, become angry at nobody in general. Then sleep is affected. You are always awake throughout the whole night. Your appetite is affected. So when these changes start occurring in you, then you realize that, no, my mental health is being affected by this pandemic. Generally, if people start experiencing a change in their normal self, then they should start becoming cautious. They should get some mental health expert to assist them and to support them. So a general move from you, if you are already a bubbly, talkative, extrovert person, and then suddenly you become withdrawn, or the reverse, if you are withdrawn and then suddenly you start becoming extrovert, talkative, that is a change from your normal self, and you should be cautious and wary of it in these challenging moments.
Dr. Essien-Baidoo, let me rope you in this conversation in terms of all the angles being covered as we move forward with the fights. If you've been listening to Dr. Usu-Antwi, she says that we haven't done enough with roping in the mental aspect of this in the whole fight. Where do you stand on that?
I think I agree perfectly with her. Again, this also draws us into the issues of stigmatization when it comes to the spread of the virus. We need to do a lot more to encourage people in terms of building up the mental health capacity to appreciate the dynamics of the infection so that we can totally appreciate the well-being of all these individuals. Like she rightly said, people become agitated, people become withdrawn, people become afraid, and that also would lead to the possibility of these people not honestly reporting signs and symptoms, which may also lead to the infectious agents remaining in the communities and spreading further to other people. So it is important that we look at that aspect as well.
Did you give a hint that the numbers may go up in the coming days, but still with that confidence that it's not alarming?
Yes, I believe the numbers may go up in the coming days. If you look at the predictive mathematical models that have been developed by quite a number of people in the country and what has been done elsewhere, our case count may increase a little bit up to about May ending, but would still be within the appreciable rate in terms of the total infections per million population of Ghana. And that is not alarming at all.
So, Dr. Usu-Antwi, how do I get convinced that when I see the numbers climb up, as in the charts, and even though some have said it's not good for you to be monitoring, everybody is ready. As soon as Information Ministry say we have a press briefing, people are waiting for the case counts, whether it's gone up or it's stable. How do I convince myself that even though I see the numbers go up and recoveries that low, it's still not alarming? Mentally, how do I psych myself up that way?
You would have to believe in the system. If an expert comes and tells us that these rising numbers are because of A, B, C, D, and that we should not be alarmed, you would have to believe in the experts. The virologists are talking, the public health experts are talking, and they are telling us that what we are seeing in the rise in numbers is probably backlog samples, and that we are at a better state of controlling the spread and all that. Take your information from the right source, and if you are getting it from the right source, then there is no point to be worried. Again, one thing that can help us reduce our anxiety about this pandemic is that we should balance the rate at which we are checking these numbers. People are constantly on the net, constantly on the social media, just checking numbers, rising numbers. Some people go beyond Ghana and they are checking it all over the world. The advice to help us reduce our anxiety is to check once in a while in the course of the day. Some people have advised that just decide that maybe 6 a.m., 6 p.m., or probably just once in the day, you will get to the right source or a good news channel like Joy News and get an update of these numbers instead of constantly checking up on websites, on social media for these figures. That would also help in reducing the anxiety.
That almost sounds impossible when we're on various WhatsApp groups and you don't call for it, people just forward things to you.
So the phone or your electronic gadget is yours. You choose to open those documents forwarded to you or not. You can be on social media to just distract yourself, doing other things, getting in touch with friends, hooking up with friends virtually, and keeping the social communication going, rather than being on a particular site, say WHO site or Ghana Health Service site, constantly just following up figures and reading graphs and trying to do some interpretations on your own. And so whatever electronic gadget you are holding, even people should extend or forward messages to you. It is your duty to open this information and check or not. And so the advice is that let us balance how often we follow up with these figures in the course of the day. It will be advisable for each person to dedicate a particular time, even if it's 30 minutes in the day, just to abreast themselves with current issues, current protective measures, current numbers concerning the pandemic in the country.
Dr. Essien-Baidoo, Dr. Oswanchi talks about trusting the system and believing what the experts say. Do you think we need a daily kind of briefing so that if people know that, oh, they're being communicated to every day, at least on the situation at hand, then they can say confidently? Because I'm sure you've heard some people say, oh, I think they're holding on to some of the numbers and they're just releasing them because they don't want to bring it all out at the same time.
Not necessarily. I believe that we can improve upon communication to build trust among the populace. What I see lacking basically is the fact that people don't trust the information that comes, and so they're speculating here and there and all of that. I need that we can improve upon communication, not necessarily on a daily basis, but for instance, issues relating to backlog of tests, communities where contacts have been traced and have been found infected, and other things can be made known to the public so that such people can be a bit more calm. And that would also build trust in whatever is being sold to the public, and that would also help in the fight as well.
Please explain this to us. There is a backlog, samples that have been collected, still testing, and we're getting to know the results. But we know that there are secondary contacts as well. So if you took my sample and I don't know what the results is yet, I will still be waiting. Meanwhile, I have made contacts with other people. What happens? Because does it mean that until my result is known, the other possible people that I have contacted may not even know what's going on with me, so they may have no idea and still be going on with normal business?
I think that is our biggest challenge. And if you look at the measures that have been put in place so far, particularly physical distancing and then the wearing of the mask, I must say that quite a number of people are insensitive to other people. And so because they are not showing any overt signs and symptoms, people refuse to wear the mask. Even those who wear them do not wear them properly. You walk through town and you see people cover only their mouth and leave the nose. Others would cover the nose and leave the mouth and all of that. Now, when this happens, basically what happens is that if my sample has been taken and is in the backlog, it means that potentially I may be a carrier of the virus. Now I have to be sensitive to all the other people around me. So I practice social distancing, physical distancing. I wash my hands regularly. I put on my mask properly so that I protect myself as well as all the secondary contacts that are around me. And that is what I think we should encourage. That is what I think the communication should highlight a lot more on. So that whilst we wait for the test results to come, we would be able to practice this thing and then prevent the spread of the infection.
Dr. Oswanchi, we've heard about some, and I have spoken to a medical practitioner who tested positive for COVID-19. Last Friday, as we were celebrating frontliners and clapping for them, one of the nurses on duty also talked about how people in her neighborhood fear getting close to her, knowing that she's a nurse in a facility where she takes care of COVID-19 patients. What is there particularly for practitioners? We know in Accra, the UGMC, University of Ghana Medical Center, has come up with an app. They basically want medical or health practitioners to reach out and share symptoms and things going on with them so that they can help them. But in terms of how we're fighting this disease, what kind of particular attention are we paying to healthcare practitioners?
Well, it's amazing that in all of this, the mental health of healthcare providers have been relegated to the background. The stigma is an issue. Once you work in the hospital, you go home, and the usual thing of your children coming to embrace you, coming to welcome you, is all now have been put on hold. You want to make sure that you put away everything that you brought from the hospital, enter the house through a backyard or shower somewhere before you even get home. I was talking to some of my colleagues who were saying that now they don't want their kids to come close. And as much as you explain to these kids, because they are home all the time, they would wish that they would cuddle around mommy and daddy and all that. But we are keeping our distance. In fact, there are some health workers who have actually moved out of home, or they are actually staying in their guest rooms just to make sure that in case they get infected, they do not infect they do not pass on the infection to their family. And so healthcare providers must constantly receive psychosocial support. What I have advised the health team at Komfanoche, for instance, is that at the end of every shift, the team should come together, do some short form of debriefing. How was the day like? How was the shift like? Were there difficulties along the line? Was there any points that actually broke you down or you are having challenges with, so that the emotional trauma is not carried on to the following day? So at the end of every shift, the team that were on duty should do a quick debriefing. There should be the presence of a clinical psychologist or mental health expert to go through that shift with them and make sure that they are all fine and settled and ready to face the next day. So these are some of the things that we should put in place. Everywhere, health workers must constantly receive psychosocial support, especially those who are working on the isolation wards, those who are at the triage, and those who are really people who meet patients at the first point of call. Everyone should get some form of psychosocial support, and it should run through the entire period of this pandemic.
Dr. Essien, this is a very good call. Is it something that can easily be done across?
Oh yes, I think it can easily be done across, and we have a lot of people who can support this as well.
Okay, I was thinking that we would what would get us to incorporate some of these things. You know, when we have conversations with people with expert knowledge in these areas, there are a lot of things that are shared. But how do we nationalize it, you know, going forward? So we know the states, for instance, took care of money matters. And in the initial stages, everybody was thinking risk allowance. But as we move on, we realize that it's not just about money. If you don't have the right mental health, you can't even enjoy the money that you earn in the end. So how do we nationalize all these ideas that come together? Beautiful idea shared right there by Dr. Uswentri.
I think we need to let the science and the information that we gather in terms of the evidence guide us in our decision making. And we need to use the best information out there to make all these decisions. Politicians should be committed to relying on the science, the evidence, and the expertise to guide their decision-making processes. Once we can have that done, I am sure we should be fighting this head-on.
Before we wrap up, I want us to talk briefly about the recovery rates. You are a virologist, Dr. Essien-Baidoo, and you believe we're on the right track. We're doing way better than a lot of the other countries. In terms of the recovery, is this still good, the rates?
Our recovery is not so good. We may have to interrogate a little bit more the interventions that have been put in place in terms of how we are managing the active cases that we have identified so far, and probably do a local review of the management strategies to see if we can speed up the recovery rate as well. I think that locally there are also some ethno-pharmaceutical agents that have been purported to be very good at fighting the virus. We need to also look at probably investing in research of some of those ethno-pharmaceuticals to see if that can also be used to augment the orthodox pharmaceuticals that we have in managing the infection. I'm sure if we can have a blend of these two, our recovery rates should be increasing by the day.
Should we ease or be thinking about easing what we have going on? I mean, when we talk about easing, especially because of the lockdown, and that lockdown has been lifted, people forget that we still have other directives regulating us, even though some people flout those directives. We've seen it happening with the chieftaincy issue. Should we begin to be thinking about easing further what we have done? Dr. Essien-Baidoo?
Not at all, not at all, not at all. As I said earlier on, we need to be sensitive to ourselves and then to the people
But the numbers are good from the experts like yourself. We're doing well. The numbers are good. We've taken enough samples. These are backlog cases that we're testing. So we should be looking at moving forward as a society.
Yes, but we can only move forward if we continue to social distance, continue to physical distance, wear masks, and then prevent further spread of the virus. I think that it is important that we let people understand the fact that if we don't adhere strictly to the protocols that have been laid down, there is always that potential of having an exponential increase. Now, if you go to some of the corporate institutions, there's a notice on, or you find notices on their doors or the entrance saying that no mask, no entry. But ask yourself, the woman who is to the street is wearing a mask. A person coming to buy the tomato is not wearing a mask. And for me, that is the greatest issue we need to look at. We need to enforce all these regulations. If you go to some places, people suddenly have forgotten that we need to socially distance, we need to physically distance, we need to wash our hands, and it's as if everything is back to normal. We need to enforce these things so that the small numbers of infections we have within our communities, we can manage them, we can treat them, and get it out of our communities entirely.
Dr. Uswenchi, how else do we do this? Because we can't always get law enforcement to enforce these directives. These are things that we should incorporate in our daily lives, and it has to become a habit. How do we do it?
Well, psychologically, it's said that when somebody does something over and over again, over a 21-day period, it is likely to become a habit. The only way we can enforce some of these things and make it part of us is to ensure that they are constantly being done. Even if it would take law enforcing agents to come into the picture and make sure that people are wearing masks. If the police is on the road and they meet you, and now one of the criteria to bypass a barrier or to drive past them is that you are wearing a mask, then it should be done. As human beings, we don't want change, or change does not easily come with us. And so some form of law enforcement must come in. When you go out to buy anything and people are queuing close to each other, there must be somebody standing somewhere, ensuring that social distancing is kept, ensuring that there are hand sanitizers. And so nationwide, there should be some laws passed such that even at our workplaces, at our shops, in the markets, all over the country, people are insisting that these infection prevention measures are carried out to the letter. If we're able to do that consistently for about 21 days, they are likely to become a habit and stay with us for good. And since this pandemic broke in the country, it's well over 21 days.
Okay, so Dr. Uswanchi, we lost you briefly, but I just wanted to say you reminded us of trusting the system in your earlier submissions. When we see law enforcement agencies not act, the same way, if it's selective acting, if you like, how do we trust that same law enforcement agency? How do we trust the system when we don't see law enforcement being carried out in an equitable manner? Okay, I think we lost you there. So let me put that to you, Dr. Samuel Essien-Baidoo. I hope you heard me.
Yes, I think that education should still continue. We need to.
Is it the agencies responsible for the enforcement that we have to educate?
Yes, we need to educate them as well. And as I said earlier on, I think politicians should be committed to relying on the science and the evidence to act. If the law enforcement agencies themselves are not complying with the directives, it would make it difficult for them to supervise anybody in that same regard. And I think that we need absolute commitment from everybody, from politicians, from law enforcement agencies and everyone, so that we can win this fight.
Okay, Dr. Samuel Essien-Baidoo, a virologist with the University of Cape Coast. Well, we'll keep talking to you because, this disease is with us. Dr. Uswanchi, I don't know if you're... Okay, we lost you there. I just wanted to rope you in and link you to our next conversation. There's also another aspect of this mental health that we need to discuss, and that's the fact that quite a number of people have lost their jobs, a number of people haven't been paid. Things have changed in the workplace. People are working from home. Not everybody can do that. So we're talking about how HR has, how work has changed. Up next, we've got some great personalities discussing this new working, whatever protocols or what we're doing now, whether or not it has come to stay. How do those who are not able to work comfortably where they live also do that? That's our next conversation. Stay with us. Roland Walker will lead us.